The next treatment option for acne scars are fillers. Fillers are typically collagen that are produced in a lab, and they are injected into acne scars in order to fill it in. They work amazingly great. I love fillers because they really smooth out the skin and give you really that improvement that you want. In contrast to other types of procedures like TCA cross, subcision, or lasers, fillers are only temporary. The body is going to break down those collagen within 6 to 9 months. So after 6 to 9 months, you're going to go back to where you were before. Whereas with other procedures, when you stimulate those collagens, they're typically more permanent. There are many different types of fillers that exist. One is called Juvederm, and another one is called Restylane. I use both of them depending upon the patient's type of acne scars. And what we do is basically we just go into the acne scars and basically inject them in order to fill in those acne scars and bring them to the same level of the skin. For the most part, they're very safe. The risk of bruising that could happen. But besides that, for the most part, they're very safe, especially in doctors who have done them many times. So when somebody comes and has a major event in about a week or two and wants the acne scars to look a lot better, typically fillers are my #1 choice of trying to make the skin look better.